Good afternoon, respected judges, participants, and all others present here. I am Faisal Atheefa, undergraduate of Faculty of Siddha Medicine, Trincomalee campus. Today, I am going to present my review research regarding postnatal care and its impact on maternal and childhood, insight from Siddha Medicine. Postnatal period is a period where the mother returns to their pre-pregnancy state. This period is very important for both mother and child. This because many deaths of mother and baby occurs during this period. By proper care of mother and baby, we can prevent and decrease these death rates. As per WHO, they have recommended 6-week period as a postnatal care, which we also call as the period of purpurium. In Siddha system, they emphasizes 31-day period, which they called as Asausam, the period of purification, which aligns with this modern time period, which recommended by WHO. In Siddha system, they have mentioned several rituals and practices to take care of mother and newborn and help in their health. The first thing is they emphasize about the rest and sleep for both mother and child. The next one is supporting their lactation and strengthen the mother by some diets and tonics. The next thing they have emphasized about some herbal formulation to increase the newborn immunity. Other than that, they have given a very important place for the hygiene for both mother and child. Though these practices are common worldwide, but the research regarding this is very rare. So here I have documented and analyzed postpartum customs in Siddha medicine to understand health benefits for maternal and neonatal health. This is a review-based analytical research mainly focusing how postnatal care or in Siddha system supports the health of the mother and baby. The information was systematically collected through both modern databases like PubMed, Google Scholar, Scopus, ResearchGate, and also some Siddha classical text and traditional medicine manuals. The keyword used for searching were postnatal care, maternal health, child health, Siddha medicine, traditional medicine, and herbal formulation. The all studies and publications in English and Tamil, which were published in the time period between 1993 to 2025 were included, which discussed about postnatal care and health benefits. The data were collected and extracted manually from selected studies, covering all the postnatal practices, herbal medicine, administration method mentioned in the Siddha medicine. The data were narratively synthesis, highlighting evidence gaps and therapeutic benefits. All the data were properly cited. Now let's see what are the practices mentioned in the Siddha system. The first one, they have divided maternal and neonatal care. In the maternal care, first they have emphasized, given an important place to the rest. They advise to keep the mother in a well-ventilated, calm place to support physically and psychologically, because a mother need a proper rest to overcome, because already they have affected physically and psychologically. So they need adequate rest to overcome that. Other than that, they have mentioned to limit the visitors for first 3 days to prevent the infection. The next thing they have emphasized about the diet, as the digestive power of the mother reduced, they advise to take easily digestible diets for the first 2 days, like milk and porridge. From day 3 onward, they have advised to take the advised to add the curries like tender brinjal, moringa, and also the food which supports and improves their lactation, like fish varieties like shark, and also they advise to avoid salt, sour, astringent foods. Not only that, they have mentioned some several herb formulation to the delivered mother. The first thing is Kasturi. Kasturi means months. Immediately after delivery, they have advised to give Kasturi. They have a practice that Kasturi, the musk is wrapping in betel leaves and giving, which act as a cardiac protective for the mother. The next thing is Saubhagya Chundi, which is a 22 herbs, medicine herbs included in that formulation. Main one is the dry ginger. Dry ginger has some chemical formulation like gingeradiol, which helps to improve the maternal recovery and also improve the milk secretions and reduce the postpartum pain. The next one is Vendaya Kulambu and Tannir Vittan Kilangu. Here Vendaya means fenugreek, Tannir Vittan Kilangu means Asparagus racemosus satavari. Both these having the action of galactagogue, so it supports the mother in increasing the milk flow. So the bonding between the mother and the baby here improving. The next one is Kayam and Sarakku. As I earlier mentioned, here also the dry ginger, other than that cumin, turmeric also adding in this herbal preparation. The main action is to return uterine recovery, to give energy to mother, to promote lactation. Here they have advice to avoid ginger in C-section mothers because the ginger has action of blood thinning property. So there is a chance of bleeding in C-section mothers. So they advise to avoid dry ginger for C-section mothers. The next, as the sleep, rest, and the diet, they have given a very important place for the hygiene also. Because hygiene is very important to prevent infection and to promote the wound healing. In that, they mentioned about some herbal baths. In the herbal bath, they advise to include turmeric, mango leaves, pepper, and also in the perineal care, they advise to add Tripala Churnam. Tripala Churnam has an astringent activity which controls the lochia. Turmeric have antimicrobial property which prevents the infections and promote wound healing. The next thing is early ambulation. They advise to walk mother from day 2 onwards because the early, as the research, the early ambulation supports to improve the increase the mother's wound healing activity by increasing the blood circulation to the uterine cavity and surrounding organs. From these, the gut motility also increase. It also helps in quick wound recovery. Next thing, the second part is neonatal care. In the neonatal care, they have mentioned about the immediate postpartum care, which means after delivery, immediately they have following some practices. The first thing is clearing the airway of the baby. By a clean white cloth, they have to remove the mucus inside the mouth of the baby to clear the airway. The next thing is clamp and cut the umbilical cord safely. And then after, they advise to wash the baby with a lukewarm water and to clean and remove the vernix caseosa. Here, vernix caseosa means a greasy white substance covering the baby, which is a secretion of sebaceous gland. Then, tie cords equally to prevent infection and should dress the baby comfortably and warmly. The next thing is very important thing is the breastfeeding, the colostrum feeding. Immediately after delivery, they have advised to feed the baby because the colostrum contain the IgA antibodies. These IgA antibodies giving passive immunity to baby. And also, this colostrum helps to clear meconium. If the mother is unwell, they have mentioned some alternative methods instead of breast milk. They mentioned that they can give cow's milk with adding some boiled cooled water to the cow's milk with proper proportions. The next thing is newborn bathing. As for the mothers, they have also mentioned some herbal bathings for the baby also. In that, they have add some herbs like henna, fenugreek, and also advised to massage the baby with some powders like chiaka, green gram. Then, and also they have given important for bathing. The bathing should be done by a skilled caregivers only, and also the baby should be handled very gently. and also avoid water entering to nose and ears. The next thing is sleep requirement. For the newborns, they advise to the newborn should be sleep from 18 to 12 hours of sleep, prefer mostly both in the day and night, and also the proper position should be maintained to avoid suffocation and injury. In the postnatal clothing, they advise to use the clothing based on the climate. If the climate is very hot, they advise to wear some cotton cloths, and if it is a cold climate, they have advised to use some head coverings and wool cloths. Other thing is the immunity support. For the newborn, they have mentioned some herbal formulations like Seinai and Uraimatrai. Both were in practice. Both were, in practice in India. The Uraimatrai is given from 3rd month onward up to 5 years to prevent the respiratory and gastrointestinal disorders. Now let's see how these practices which mentioned in the Siddha system helps, and what are the researchers regarding these researchers supporting this study. The first thing is rest. I already mentioned that the rest is important for both mother. The sleep is important for both mother and baby, because this in the research they shows that the deprivation of sleep is a risk factor for postpartum depression. The postpartum depression affect the maternal and neonatal bonding. So if the sleep is deprived, there is a risk of the postpartum depression. So should avoid this. This practice will help to avoid these circumstances. Other thing is the newborn sleep. Newborn sleep, they advise to take 18 to 20 hours of sleep. The newborn sleep is very important to improve their cognitive power, their and also they are improving their brain memory and everything. The next one is Kasturi. I already mentioned about the Kasturi. After delivery, they have a ritual of giving a musk which contain a musk corn, is a chemical composition in the musk which have a cardioprotective activity. As after the delivery, the blood volume in the mother drastically change. The blood in the uterus is returns to the mother circulation. So the blood volume increase, cardiac output increase, so the stress to heart increase. So they to protect this, there's a tradition giving kasturi, the musk, to the mother. The next thing I mentioned about dry ginger. Most of the herbal formulation, they have included dry ginger. The dry ginger having several activities. Here I have mentioned mainly which reduce postpartum pain and support lactation. So the several studies um, proves that the dry ginger have action of reducing postpartum pain and supports the lactation. The next thing is cumin. Cumin also having some actions like galactagogue and antimicrobial activities which helps for the maternal recovery. The next one is turmeric. We all know that turmeric having some actions like antimicrobial, wound healing. Other than that, it has a very specific action to prevent the postpartum depression. Curcumin is a chemical composition in the rhizome of turmeric, which helps in secretion of the serotonin and dopamine. The studies proves that. So this helps to prevent the postpartum depression in the mother. The next thing is Tannir Vittan Kilangu. Tannir Vittan Kilangu, Asparagus racemosus, which contains a chemical composition called satavarin. This satavarin helps in increasing oxytocin and prolactin. Through that, it increases the flow of breast milk. Other thing is fenugreek. This also having the same action like Tannir Vittan Kilangu. It also improves the lactation because it having action of galactagogue. Next thing is garlic, which have antimicrobial activity, and it contains sulfur, so it helps in wound healing. The next thing I mentioned about the herbal bath and perineal and local care. The research, they have done some research based on the turmeric. Turmeric gel apply for the perineum to they have evidence. There are evidence that this applying turmeric increase the wound healing activity and also controls the lochia. The next one is early ambulation. As I already mentioned, early ambulation practice improve in the gut motility, improves in wound healing by increasing the blood supply to the uterus and also organs surrounding the uterus. So based on this study, the postnatal care in the Siddha system helps to improve the maternal recovery, increase the maternal strength, and also improve the flow of enhance the flow of breast milk secretion, increasing the immunity in child. All these studies aligns with the modern biomedical recommendation, but some more research, clinical research, needed to prove this. So as a conclusion, this postnatal care practices will helps for both mother and maternal recovery. Thank you.
Okay, Dr. Faisal, nice presentation. You have mentioned in Siddha medicine, puerperium period is 31 days, no?
Yes, madam.
Yes. If you have given your findings, all the things like table, what are the mentioned in Siddha as well as Ayurveda, Unani and modern, it is much more better, but your attempt is very good. We appreciate your work. Okay.
Okay.
If any question, ask from the audience. Any clarification need, you can ask from Dr. Faisal. Dr. Faisal?
Yes. Yes, madam.
What are the measures for cleaning the vernix caseosa in Siddha medicine?
They have mentioned about bathing the baby with the lukewarm water after the delivery and wipe off with a clean cloth.
Okay. Okay, thank you.